All right, welcome back to a new topic. This time we're going to be getting into treatment of psychological disorders, following up from the coverage of psychological disorders generally in the last topic. This will be our second to last topic in this course. The last topic will be social psychology. But for now, I'm going to focus on psychotherapy, including psychodynamic, behavioral, and cognitive approaches to treatment. Well, first off, the psychodynamic approach to therapy seeks to bring unresolved past conflicts and unacceptable impulses from the unconscious into the conscious, where the patient can deal with the problem more effectively. And that's the overall idea, is that according to the psychodynamic approach, the therapist doesn't want the patient to be repressing all kinds of negative memories, negative feelings from childhood. Rather, it's best to bring them into the conscious mind and deal with them, and that's the only way to move on from these repressed issues. Again, according to the psychodynamic approach. Psychoanalysis is still used, which is the classic Freudian therapy that involves frequent sessions over the course of many years. Now, this is not a very common approach these days, but still out there. And these are some techniques that come along with the psychodynamic approach. And psychoanalysis, generally speaking, free association. So the patient is instructed to say whatever comes to their mind. Okay, and the usual kind of stereotypical patient laying on the couch next to or behind the the therapist is still a common approach. Okay, and so they lay back, they get relaxed, they might close their eyes and just start free association. Okay, and the idea is that the therapist can detect certain key words to focus on and really dive into with a discussion with the patient. Dream interpretation, often, well, I don't know about often, but can still be used today. The goal, of course, is to discover the latent or underlying content of dreams, if that latent content exists, and that's debatable. Resistance certainly can occur within psychodynamic therapy, which is, so resistance is the inability or unwillingness to discuss certain memories, thoughts, or motivations. Of course, many patients are going to resist certain therapeutic techniques until some time goes by, many sessions go by, a good rapport is built with the therapist. And transference. Okay, you might have heard of this before. The transfer to a psychoanalyst feelings of love or anger that had been originally directed to a patient's parents or other authority figures. Okay, so the therapist is the only other person in the room here, and so if the therapist is successful at getting these repressed, unconscious memories, urges, feelings to come into the conscious mind for the patient to deal with them, well, there can be some side effects there, certainly, where the patient can turn these against the therapist, okay? And that could be a negative thing or a positive thing in terms of, are these feelings of love or anger? But in either way, regardless of the positive or negative aspect of the feelings, something the therapist needs to be ready for, needs to be able to deal with that issue of transference and understand that, hey, it's not necessarily that the patient has fallen in love with the therapist or is really, really angry at the therapist for anything the therapist really did. It could just be a matter of transference, and there are ways of dealing with that based on the therapist's training in psychodynamic approaches. Well, an evaluation of the psychodynamic dynamic approach is that, hey, it's very time-consuming. As I mentioned, it typically lasts many months, if not years, of many sessions, okay? So, of course, it's very expensive. It's more difficult for less verbal patients, okay? So not everyone is very verbal, very willing to speak a lot about what's going through their head. This free association sort of thing, this interpretation of dreams, all elicited via verbalization, okay? Not everyone's very verbal, so it's not going to work for all patients. Very controversial. It continues to be controversial, but it's still, the psychodynamic approach is still taught in some places. There's no objective evidence of effectiveness, okay? And as I pointed out earlier in the course, there's not a lot of objective evidence for the unconscious mind as Freud viewed it and as current psychodynamic therapists view the unconscious mind and repression, okay? Not a lot of evidence for that. Well, in the next segment, I'll get into some more modern, much more popular approaches such as behavioral and cognitive behavioral approaches, or CBT.